If you're sick right now and thinking, is this bronchitis, pneumonia, or strep throat? If so, I'm going to help you figure out which one it is by using one simple test, the throat, chest, and lungs test. These three problems usually affect different parts of the body, and in a minute, you'll know which one fits your symptoms and if you should get checked immediately. But first, keep in mind that this is general education, not personal medical advice. If you feel seriously unwell or you are getting worse, seek medical help. Now do this with me for a second. Point to the main place you feel the discomfort the most. Your throat, your chest, or deep in your lungs. Here's exactly what I mean. Throat means the discomfort is mostly in your throat. It hurts to swallow. Your throat feels raw or sharp. The soreness is in the front of the neck where your tonsils are. Chest means the discomfort is mostly in your chest. You're coughing a lot. Your chest feels tight or irritated. You may hear or feel a wheeze. This usually comes from the breathing tubes being inflamed. Deep in the lungs means the discomfort is in the lungs. Breathing feels harder than normal. You may feel short of breath doing small things. Taking a deep breath may feel uncomfortable because the problem is down in the lungs, not just in the throat or breathing tubes. If you can name the main place you feel the problem, you stop guessing based on one random symptom. In the next few minutes, you'll get three things. First, the throat, chest, and lungs test so you have a clear starting point. Second, the warning signs that tells you if you should get medical help right away. Third, a simple way to know when a sore throat should be tested for strep throat. And I'll tell you the exact tests doctors use, so if you go to an urgent care, you know what to ask for and why. Let's clear up the biggest misunderstanding. Most people are taught this. Sore throat means strep throat. Big cough means bronchitis. High fever means pneumonia. Sometimes that is true, but a virus can also cause sore throat, cough, and fever. So a single symptom by itself is not enough. That's why we start with a better question. Where do you feel the main problem? Throat, chest, or deep in the lungs? Now here is the definition of each one. Strep throat is a bacterial infection in the throat and tonsils. It often causes strong throat pain and fever. It is confirmed with a strep test. Bronchitis is irritation and swelling in the breathing tubes. The cough becomes the main problem. Many cases happen after a cold, and many are caused by viruses. Pneumonia is an infection or inflammation down in the lungs. This can make breathing harder, and it can reduce oxygen. That is why pneumonia is the one we take most seriously when breathing is affected. Now, I want to make this practical with real examples. If your main complaint is, "My throat hurts so much I don't want to swallow," that points you towards strep throat. If your main complaint is, "I cannot stop coughing and my chest feels irritated," that points you toward bronchitis. If your main complaint is, "Breathing feels harder than normal and I get winded doing small things," that points you toward pneumonia. Now we'll go one by one, starting with strep throat, because this is where people get confused. A lot of sore throats are viral. Viral sore throats can hurt badly and they do not need antibiotics. Strep throat is different because antibiotics may be needed, especially to reduce complications and to reduce spread to others. So the goal is simple. Know when to test. Strep throat often looks like this. The sore throat starts quickly. Swallowing hurts. Fever is common. The glands in the neck may feel tender. Some people have swollen tonsils. And here is a key clue that helps many people. A strong cough makes strep throat less likely. That does not mean cough makes it impossible, but it makes it less likely. Here is another clear point. You cannot confirm strep throat by looking in the mirror. Redness is not enough. White patches are not enough. The way to know is a rapid strep throat test, and sometimes a throat culture. So when should you get tested? Use this simple rule. If you have 2 or more of these, get tested sooner. Fever, cough, very painful swallowing, tender neck glands. If you have these signs, a test is the next step. Now, even if it is not strep throat, your throat can still hurt a lot. So here's what helps in plain terms. Warm drinks can reduce throat irritation. Humidified air can reduce dryness. Drink enough water, rest. Avoid smoke and vaping because they irritate the throat and airways. And if you have trouble swallowing fluids or you cannot keep fluids down, that is a reason to get checked. Now let's move to bronchitis. Bronchitis usually happens when the breathing tubes stay irritated after a cold. That is why the cough becomes the main problem. Common bronchitis signs include a cough that lasts and comes in coughing fits. Your chest may feel sore from coughing. You may have mucus. It can be clear, yellow, or green. You may have wheezing or tightness, especially at night or with activity. Now let's address a very common misunderstanding. Mucus color alone does not tell you if you need antibiotics. Viruses can also cause yellow or green mucus. So what matters more? These 3 questions. Is your breathing okay when you are resting? Is fever going down after a couple of days? Can you do a little more than yesterday? If the answer is yes, that supports a less urgent situation. If the answer is no, especially if breathing is worse, that changes the plan. Here is another important point people need to hear. A bronchitis cough can last longer than people expect. It can continue even after other symptoms improve. That does not automatically mean it is pneumonia. But the cough should not come with new serious breathing trouble, strong chest pain with deep breaths, or worsening fever. If those appear, you need to get checked. Now we move to pneumonia, and I want you to listen closely. Pneumonia is down in the lungs, so the key question is not, how loud is my cough? The key question is breathing becoming harder? Here are signs that make pneumonia more likely. Breathing feels harder than normal. You get out of breath doing small things like walking to the bathroom or across the room. Fever stays high for days, or fever goes away and then returns. Chest pain happens when you take a deep breath, and many people feel very weak and very tired. Now I'm going to give you 2 quick checks you can do at home. These do not diagnose pneumonia. They help you decide how urgent the situation may be. First, the full sentence check. Say 1 full sentence out loud at a normal pace. If you have to stop to catch your breath, especially while resting, get checked. Second, the room walk check. Walk across the room at a normal pace. If you are unusually short of breath compared to normal, especially with fever, get checked. Now, some warning signs mean you should get urgent help immediately. Severe trouble breathing, lips or face turning bluish or gray. Confusion, fainting, or extreme sleepiness. Strong chest pain that does not go away. You cannot keep fluids down for many hours. Or you feel rapidly worse, especially if you are an older adult or you have serious medical conditions, like chronic lung disease, heart disease, or a weakened immune system. If any of those apply, do not delay. Now let's talk about what doctors actually do so you know what to expect. For strep throat, doctors use a rapid strep test and sometimes a throat culture. For breathing problems, they often check oxygen with a finger device called a pulse oximeter. They listen to the lungs with a stethoscope. They check your breathing rate. They may order a chest x-ray if pneumonia is a concern. Depending on your symptoms and what is common in your area, they may also test for viruses like flu or COVID. The reason I'm telling you this is simple. When you know what the doctor is looking for, you can communicate clearly and get the right evaluation. Now here is a very helpful test you can use anytime. Step 1. Do the throat, chest, and lungs test. Where is the main problem? Mostly throat means it is more likely strep throat or a viral sore throat. Mostly chest and cough means it is more likely bronchitis. Mostly deep breathing trouble means it is more likely to be pneumonia, and you should get checked as soon as possible. Step 2. Answer these 5 questions. 1. Is breathing harder than normal? 2. Can you speak a full sentence without stopping for air? 3. Is fever staying high for days or returning after going away? 4. Do deep breaths cause chest pain? 5. Are you getting worse after several days instead of slowly improving? If you answer yes to several, especially the breathing questions, get checked. Now I'm going to give you exact words you can use at urgent care. Keep it short and clear. My breathing is worse than normal. I have to stop to catch my breath when I talk. My fever is not improving. I'm worried about pneumonia. That tells the doctor what matters: breathing, oxygen level, lung exam, and whether you need a chest x-ray or other tests. Now let's do a quick recap because this is the part you want to remember. Strep throat. The throat is the main problem. Swallowing hurts. Fever is common. Often there is little or no cough. Bronchitis. The cough is the main problem. The chest feels irritated or tight. Wheezing can happen. Mucus color alone does not tell you if you need antibiotics. Pneumonia. Breathing becomes the main problem. You get out of breath doing small things. Fever may stay high or return. Deep breaths can cause chest pain. And if you have serious breathing trouble or confusion, get urgent help immediately.